The following is a short presentation outlining how working less than full-time affects your pay. The introduction of the new Junior Doctors Contract in 2016 has simplified how pay for less than full-time trainees is calculated. The previous banding system is no longer used. Less than full-time pay is now calculated pro rata to full-time pay. Enhanced rates for nights and weekend working are also calculated pro rata over the course of the rota in the same way that full-time trainees are paid. In addition, less than full-time trainees are entitled to claim an LTFT premium of £1,000 per year. This is to help towards costs such as GMC fees and other training expenses that LTFT trainees still have to pay while on lower salaries. This resource has been produced by the BMA and explains how basic pay, enhanced rates for out-of-hours shifts and pay premia work. This, along with further information, can be found on their website. As mentioned, LTFT trainees still face many of the professional expenses incurred by full-time trainees while earning less money. However, some allowances do exist. The GMC offer a 50% reduction in fees to any doctors with income below a certain threshold within a tax year. Similarly, the BMA and some Royal Colleges offer reduced fees to those training less than full-time if their income is below a certain threshold. It is worthwhile contacting your medical indemnity provider to inform them if you are working less than full-time, as quotes are often based on the amount of work you undertake, so being less than full-time may lower your fees. You are most likely to be eligible for these discounts if you are working 60% or less, or you are earlier in your career and therefore at the lower nodal points on the pay scale. However, it is also worth remembering to consider this if you have spent time during a particular tax year on maternity leave or on reduced pay due to sickness or undertaking research, because it is usually your overall earnings for the tax year from April to April which determine your eligibility for discounted rates. The next issue to consider is that working less than full-time during training can affect the point on the pay scale you should start at when you become a consultant. Let's take this example. Sarah is a paediatric trainee. It takes her 14 years to complete her 8-year training programme. 2 years are spent doing research, 2 years are spent on maternity leave, and her training is extended by a total of 2 years due to working less than full-time at different percentages. When she starts work as a consultant, she is entitled to be paid at year 3 on the pay scale rather than year 1 because her training was extended by 2 years due to working less than full-time. Some employing trusts may consider allowing her to start on year 5 of the pay scale due to her time spent undertaking research if they feel that this was particularly important to her being employed in that consultant role. However, time spent on maternity leave or out of the workplace for other reasons does not count towards starting on higher points of the consultant pay scale. And finally, pensions. The NHS pension scheme is a tiered system with the percentage you pay being determined by your basic income. In other words, what you earn before any additional enhanced rates for nights or weekend working or additional pay premia. This figure can be found on your payslip. There are 2 bands which apply to trainees, 9.3% and 12.5%. The threshold for paying the higher rate is a basic income of just under £48,000. Once your income goes above this threshold, you pay higher rate pension contributions on all of your income, not just the portion above the threshold. In the case of less than full-time trainees, They pay pension contributions as a percentage of their salary, but the rate is determined by their full-time equivalent. For example, if a full-time trainee has a basic salary of £50,000, a trainee working 60% in that role will have a basic salary of £30,000. The less than full-time trainee will be expected to pay pension contributions of 12.5% of £30,000 because their full-time equivalent earns above the higher rate threshold. If you would like any further information regarding any aspect of less than full-time training, the following resources may be useful.